workshop. My name is Mellisa Ptak. We are here for a kind of condensed version about prediabetes, how to prevent prediabetes, how to reverse prediabetes. So, the slides, your handout is covering all the slides, so they're yours to take home. Feel free to write on them, take notes. We'll have time for questions anytime during the presentation or even after, so just shout out if you have a question. All right, so I always like to give this disclaimer. This is for educational purposes only. I am a nurse practitioner, but I am not your provider. So anything that you learn today, these are just generalized recommendations. Before you decide to make any major changes, please always consult with your primary care provider. My goal is to help you be educated and informed for you to make good choices and decisions. You are your best advocate, so always do what you feel is best for you, okay? All right, so a little bit about me. I've been a nurse for 26 years. As I said, I'm also a nurse practitioner. I have been a certified diabetes care and education specialist for about 10 years. I moved here from Illinois. Before I came to Tennessee, I managed a hospital-based diabetes clinic. We had an outpatient office. We also had educators in a medical group, and then we also saw people in the hospital who were newly diagnosed with prediabetes or diabetes, as well as children who were diagnosed with diabetes. I also did community classes like this one, and I also went to schools to educate teachers who care for children with diabetes in the school system. So diabetes has been my passion for a long time, and just teaching and educating people is really important to me. I'm also a certified health coach, so I work one-on-one with people to personalize and individualize support and guide them to help reverse their prediabetes, type 2 diabetes, or any other health and wellness needs that people are looking for. So I really want to encourage people to improve their health and wellness. All right, so as I mentioned to you earlier, I am from Illinois, born and raised in Chicago, hence my accent. Everybody says I have a heavy Chicago accent. I moved to Cookeville about 4 years ago. We love it here. I am married. I have 2 teenage boys. We have 2 dogs, a bunch of chickens, some goats, and a horse. So we are really embracing the country life here in Cookeville. All right, so this is what we're here for. Okay, so what is prediabetes? So as the word indicates, pre, it's before you develop diabetes. And what that means is your blood sugar or your glucose, you'll hear me say, is higher than normal, but it's not high enough to be in the diabetes range. So the most common way that you discover this is during your blood work or an annual physical exam, where they check your labs and they tell you that your fasting glucose is elevated. So this little chart here shows you fasting glucose or fasting sugar. The normal range is 70 to 99, so we like it below 100. We don't do 2-hour after meal blood sugar readings very often. That's hard to do in the office. So the most common test that you may have is that A1C test. That's that 3-month average of your blood sugars. So the range, the column in the left is the prediabetes. So the A1C is 5.7 to 6.4 for prediabetes. If it's 6.5 or higher, that puts you in the diabetes range. If for some reason you're in that range, we like to repeat the test again just to confirm that it was accurate or not. But for today's purposes, we're focusing on prediabetes. So again, 5.7 to 6.4 is the 3-month A1C, and the A1C is actually past information. It's what your blood sugars were 2 to 3 months prior, okay? All right, so what's happening with prediabetes? So we have a pancreas, and the pancreas's job is to make insulin. And insulin works like a key to unlock the cells in our body, and it opens up the cells so the sugar that's in our blood moves into the cells so we can utilize it for energy, okay? So the problem with prediabetes or diabetes is you may have developed something called insulin resistance. What that means is that little key isn't working the way it's supposed to. It's not opening up the cells so the sugar can get into it so we can use it for energy. That sugar is sitting outside in the blood, causing those higher blood sugar readings. So your body is making insulin, it's just not working the way it's supposed to. And sometimes with insulin resistance, your pancreas tries to work harder to make more insulin to compensate for that. Okay, so, and we'll talk a little bit more of why that's not a good thing. Okay, so a little bit more about what exactly is insulin resistance and why it matters. So insulin resistance contributes to something called metabolic syndrome. This is an umbrella term. It basically is a cluster of other conditions such as high blood pressure, elevated cholesterol levels like your cholesterol, your triglycerides, your HDL, LDL, that little breakdown that you get when you have your lab work. Being overweight or obese also is under that metabolic syndrome umbrella. The reason why this is important is because insulin resistance, again, like I said earlier, causes our body to try to make more insulin to compensate. But insulin is also a fat-storing hormone, so it can cause us to gain weight. It makes it a little bit harder to lose weight. It can make us tired, low energy, make us more hungry, and it can also increase something called fatty liver disease. Insulin resistance has also been shown to increase your risk of dementia and Alzheimer's disease. They're actually starting to call Alzheimer's disease diabetes type 3. So all of these things are connected and interrelated. So who's at risk for developing insulin resistance prediabetes? Typically, it's usually people over age 45. It's more common to see people with prediabetes or diabetes as we get older. Unfortunately, as the rise and increase of abnormal weight in teens and young adults, we are seeing an increase in prediabetes and insulin resistance in our young adults and teens. But it is still more common in adults. Being overweight increases your risk. If you have a family history of diabetes, if you have a history of diabetes during pregnancy or gestational diabetes, that increases your risk. And then certain ethnic groups, such as being Native American, African American, Hispanic, or Asian, also increases your risks. And we're finding more and more women in perimenopause and menopause also develop insulin resistance because of the fluctuations in hormones. So women in this stage of life may also notice that abdominal weight gain that you can't get rid of. They also notice their cholesterol and triglycerides rise, even though they haven't really changed much. So this is part of insulin resistance as well. All right, why does this matter? So our main goal is we want to prevent this from transitioning to type 2 diabetes. The reason why this is important is because diabetes increases your risk for developing other complications such as cardiovascular disease, which would include heart attacks and strokes, or peripheral arterial disease, which is poor circulation. Diabetes also increases your risk for developing eye or kidney disease. It can cause nerve damage or something called neuropathy. It increases your risk for infections or poor wound healing. And then of course it also increases your risk for gum disease and problems with your teeth. So we want to prevent all of these things. How do we do that? So basically we want to work on improving your health span. What does that mean? We want to try to improve how well you're living. How we age matters. You want to try to strengthen your body for the long term, for the long haul. You don't want to age typically. You know how we usually say, oh, that's normal, that's just a part of aging. But technically it's not. That's telling us that something is not working well in our body, and you don't want to age that way. So we want to address that part of it, okay? So you want to improve the quality of your life by getting stronger and more resilient. So I heard this from somebody else, I can't remember who, so I can't take credit for it, but you want to make yourself hard to kill. And what I mean by that is you don't want to be an easy target. So when you're unhealthy and you're not well, it's easier for you to get sick from those other outlying offenders, you know, bacteria, viruses, poor diet, things like that. So make yourself stronger and more resilient and harder to develop these other things. All right, so what causes insulin resistance? Well, how we're living is mostly what contributes to this. Lack of movement or exercise, what we're eating and drinking, poor sleep and stress also play a big role. So we'll touch on each of these separately and just kind of address some things that we can try to do to improve those things. Okay? All right, so the first thing we're going to touch on is movement and exercise. So this is in addition to your normal daily activities. You want to burn the extra sugar that you have consumed throughout the day to help keep your blood sugars in a normal range. But you want to do something that you're going to enjoy. If you don't like riding a stationary bike, don't pick that as your activity because you're not going to do it. Try to find something that you know that you're going to stick with and that you'll actually do. And then remember that every little bit counts. So even if you can only do something for 5-10 minutes, maybe once or twice a day, that's better than nothing, okay? Walking for 10 minutes after meals is very effective to help keep your blood sugar under good control. So eat a meal, wait about 20 minutes, try to go for a little 5-10 minute walk after breakfast, lunch, and dinner. If you do 10 minutes after each meal, there's 30 minutes for the day of extra walking. Studies have shown that that's actually more effective to do 10 minutes 3 times a day versus 30 minutes all at once. It's been shown to have better metabolic improvements in your blood sugar and overall health. And then I have highlighted in red, buy a pedometer. They're very low cost. You can get them at Walmart, order it online, clip it to your pants. It doesn't need to be anything fancy, but I want you to be able to track how many steps am I actually walking in a day. So again, the studies have shown if you're walking less than 4,000 steps a day, you're considered sedentary, which we want to avoid. And most people are sedentary, so we want to try to improve that. I know they say the goal is to try to get 10,000 steps a day, but research has actually shown if you can get to 8,000 steps a day, that has been shown to have significant health benefits as well. So get yourself a pedometer, gauge where you're at right now, and just make gradual progress. Okay, so right now I'm getting 3,000 steps. So in the next week or two, let me try to see how I can get up to 4,000. And then in another week or two, how can I get to 5,000? And then just keep slowly building until you can get closer to your goal of about 8,000 steps, okay? A lot of us think we move more than we actually do, and then when we actually track it, it's surprising to see, oh my gosh, I only walked 3,000 steps today. So it's a good gauge to kind of see how active are you really, okay? Exercise also increases something called BDNF, which is brain-derived neurotrophic factor. Think of this as like miracle grow for the brain, okay? It protects the brain, it improves memory, learning, and cognition. It also helps to improve your mood and to reduce symptoms of anxiety and depression. So getting outside into nature, moving, doing things, those are not only good for your body, but good for your brain as well. And then strength and resistance training is important too. You want to utilize your muscles because muscles suck up some of that extra sugar that's in your blood. And especially for women, as we age, we lose muscle mass. As we lose muscle mass, that weakens our bones and could lead to osteopenia or osteoporosis. So you want to prevent that. So even if you're limited with things that you can do, chair exercises are great, free weights, resistant bands, balancing, like standing near a counter or something and just kind of working on little leg lifts, or even if you're sitting watching TV and you're in a chair or your couch, just kind of getting up and down off the couch a few times, just using your muscles more than you're used to doing currently, okay? All right, so the next umbrella we're gonna cover is what we eat and how this affects our blood sugars and our metabolic health. So I wanna focus on what can we add to what we eat to make things better and improve our diet. So add foods that give you what your body needs to work at its best. So nutrient-dense foods, things that have antioxidants, vitamins, and minerals. So we'll touch on all of that. You want to add more protein. Your meats, beef, chicken, fish, eggs, cheese, Greek yogurts. Proteins take longer to digest. They help to keep us fuller longer, and they help us to maintain muscle mass and reduce us to lose muscle so quickly. There is a misconception that as we age, we don't need as much protein. That's actually opposite of what we want, because the one piece that is true, it's harder for us to digest or absorb some of those amino acids. When you eat protein, it gets broken down into some amino acids, so it's harder for us to kind of absorb those. So we actually need a little more protein, so we're still getting the amounts that we need. So try to avoid not getting enough protein. You want to add more non-starchy vegetables, leafy greens, broccoli, cauliflower, cabbage, anything that's not starchy. So that would be your potatoes, corn, peas. Those are starchy vegetables. We'll cover that a little bit more later. But non-starchy vegetables are similar to protein. They keep you fuller longer because they take longer to digest. So they help with satiety, and they help to control blood sugars a little better. Add more water for hydration. When you're dehydrated, your body actually wants to store more fat. So you want to avoid dehydration. Staying hydrated is important. And then you want to add more whole foods. So what I mean by that is try to avoid packaged or processed foods. Ask yourself the question, did it come from an animal? Did it come from the earth? You know, your proteins from the animal, your fruits and vegetables from the earth, or did it get processed in a factory and it comes in a box? So add those more whole nutrient-dense foods. Okay. Any questions so far about those things? All right. So carbohydrates. This is usually the biggest one that people panic about. So let's cover what exactly are carbohydrates. So carbohydrates are things that we eat that the body breaks down and it turns into sugar when we eat them. So anything made with flour, grains, or corn is a carbohydrate. So your breads, your cereals, your oatmeal, pasta, rice, grits, tortillas, crackers, cookies, cakes, the list goes on and on. Fruits have their own natural sugars in them, so they're in the carbohydrate category. And then as I mentioned earlier, starchy vegetables, so your potatoes, corn, and peas, those get broken down into more sugar. Beans and lentils, those are considered a carbohydrate, but those are like the bonus carbohydrate because they're also high in fiber and high in protein, okay? Sweetened beverages, because they have added sugar or honey or other things in them that make them sweet. So your sweet teas, your sodas, your fruit juices, those are considered carbohydrates. And then your things that you add to sweeten things. Sugar, honey, maple syrup, those are of course carbohydrates. Most alcohol has carbohydrates in it. There are higher carb alcohol items, most beer, the barley, the hops, sweetened alcoholic drinks like sweet wine, margaritas, daiquiris, things like that. So if it tastes sweet, it likely has sugar in it and is considered a carbohydrate. The reason why carbohydrates is so important is because too much sugar can cause inflammation in the body. So that causes increased joint pain and fatigue. So when you reduce your carbohydrates, that can help to lessen some of the inflammation in your body, okay? So I'm not telling you don't eat carbohydrates. That's an impossible thing to do. Moderation is important, and choosing good quality carbohydrates is important. So focus on like the natural carbohydrates, such as your fruits, your vegetables, your beans, lentils. Try to reduce the amount of unnecessary carbohydrates, such as like the cookies, cakes, candies, the sweetened beverages. My theory is I'd rather eat my carbs than drink my carbs. So I've never really been a soda or sweet tea or drinker. So I'd rather save my portioned amount of carbs for something that I can eat. So that's how I kind of think about it. All right, any questions about the carbohydrates?
In general, how many servings would you suggest?
We're gonna cover that soon. So hold on tight to that question and we'll cover like about how much to have. Good question. All right, so why does monitoring the amount of carbs we eat matter? Okay, so I want you to think of these three buckets. There's a blood bucket, there's a liver bucket, and a fat bucket. So what I mean by that is when we eat carbohydrates, it gets broken down into the sugars, and then the sugar gets into our blood. Now when the sugar bucket is full, it overflows, it has to go somewhere, so now it goes into the liver, so the liver can try to store some of that sugar. But when there's too much sugar in the liver, it gets stored as fat, and that's how we develop something called fatty liver disease. When the liver gets full and it has no place to put all of that extra sugar, now it gets moved into our fat bucket. Okay, so then it gets stored as fat. So all the sugar that we don't burn hits each of these buckets and then gets stored as fat. This is kind of a simplified version of kind of the science. And this is also why it makes it very hard to lose weight. Because if you don't empty the bucket and it keeps flowing, these buckets need to be somewhat empty before we can start emptying the fat bucket. Does that make sense? So limiting and monitoring the amount of unnecessary carbs we have keeps these in normal ranges, so then we don't have to worry about all the extra stuff getting stored as fat. Okay, does that make sense? Any questions about that part? All right, so what do we do about all of this? So that will bring us to your little packet here of your plates. So there's a little handout with a plate. And you want to think about planning your meals. Breakfast is a hard one for people because a lot of people don't like to eat breakfast. and you typically don't eat meat and vegetables for breakfast. But I try to encourage people, how can I eat protein for breakfast? Scrambled eggs, hard-boiled eggs, if you like yogurt. I'm not a big breakfast person, so sometimes I'll put a scoop of protein. I'm not a coffee drinker either, so I'll put a scoop of protein in my tea that I make just so I can get some protein. Or I'll eat like Greek yogurt and some berries, just something small to give me some protein to get me started for the day. So breakfast can be tricky, but you want to avoid your typical breakfast foods because they're all high in carbohydrates. And so starting off the day with a high carb meal tends to put most people's blood sugar really high, and it takes a long time for that to come down throughout the day. And when your blood sugar's too high, it kind of makes you sluggish and tired, and you're not getting that energy boost that you think you're getting from that high sugar meal. Do you have a question?
Can you count the protein that's in your milk and the protein that's in your cereal? Like if you have a high fiber cereal that has protein, can that be counted as your
Yes,
protein?
as long as it's on the label, and we're gonna cover that, like it says that there's a certain amount of protein, but we'll touch on cereal in a little bit too,
And
because that's a
milk, too.
tricky one. And milk has protein too, but it also is a carbohydrate, yeah. It's tricky, it takes a little practice, but as long as you're being mindful of what am I eating and how can I improve this a little bit, and every day, you just keep working on that. All right, so for lunches and dinners, I want you to try to focus on what protein can I add to this meal. Even if you go to a restaurant or something, what is the meat or protein that I'm gonna have with this meal? How can I add at least half of a plate of non-starchy vegetables? You know, a side salad, broccoli, cauliflower, any of the other non-starchy vegetables. And then the last quarter of your plate would be that carb, that starchy vegetable, potato, pasta, rice, a little dinner roll, things like that. So the key here is to focus on protein and non-starchy vegetables as the bulk of your meal, because that is what's going to keep you fuller longer, and it helps to reduce the portion of your carbohydrate. So as I talked to you ladies earlier, you know, I was raised by a Sicilian grandma, so this was very hard for me to learn because it was mostly pasta over here, and then these things were very little. So it takes some time. Give yourself time to make that shift and that transition, okay? But try to just be more mindful moving forward is, am I getting enough protein? A lot of times we don't even add a protein. How can I add protein to this meal?
I have another question. What about the whole grain pasta? If you had this regular serving of the whole grain pasta
So
and
same
then your
thing.
vegetables.
You still want to be mindful of the portion, and we're going to cover the portion of pasta and rice soon too, because that is a big one. All right, so and then here I wrote about snacks. So you want to try to have 3 meals a day, breakfast, lunch, and dinner, because that helps to kind of keep your blood sugar more stable throughout the day. When you skip a meal, your blood sugar is kind of all over the place, and the body likes slow and steady. So even if you're not a breakfast person, try to eat a little something small just to kind of help stabilize your blood sugar and prevent those big fluctuations, okay? Snacks, no more than 2 snacks a day. So plug it in where you think you need it. So like for me, between lunch and dinner, it's like I can't make it to dinner. I need a snack in between. I'm fine during the day. But with a snack, same thing. Be mindful of your carb portion, and we're going to talk about carb portions next. But have a little protein with it. You know, a cheese stick and an apple, or peanut butter and an apple, some nuts and a piece of fruit. Protein and a carb paired together, the protein slows down how quickly your blood sugar rises. So the combination is helpful to control your blood sugars. Okay? All right, any questions about that part?
You don't necessarily have to have the snacks, right? If
No,
you're just a
only
three-meal
if you
person.
feel that you need it. So, you know, back in, I don't know how many years ago, how there was the trend, 6 small meals a day.
Mhm.
No. The reason is because when you eat, your blood sugar spikes the highest in about an hour. And then it takes about an hour for that blood sugar to come back down. So you need that time in between of not eating so your body can continue to try to burn any extra sugar. Think of that as like a little mini fasting period. So you need that fasting period to continue to bring that blood sugar back down to baseline. If you're eating nonstop, your blood sugar is always here and never really coming down back to baseline. So those 3 meals and that fasting in between is really helpful. But if you need that snack, then you have that snack. But just again, it should be a snack, not like an extra meal. You know, some people's snacks are like a meal. But yeah, only if you need it. If you feel that you need it, because like otherwise I'm gonna overeat at my next meal and then it kind of just throws you out of whack. Okay, so here is an example of a label, okay? So what I want you to focus on is, see where it says serving size 1.5 cup, okay? So let's pretend that that's your cereal you're talking about. And then you're gonna look where it says total carbohydrates, 46 grams. So 1.5 cups, level. Everything is always level, not heaping. Okay, so 1.5 cups of that cereal is 46 grams of carbs. What does that mean? I apologize, this is a little mathy, so people who aren't good with math, this can confuse people, but I tried to break it down to make it very simple. So we're gonna think of carb servings equals how many grams of carbs, okay? So I broke it down here. 1 carb serving is 15 grams of carbohydrates. And then you're just gonna add 15 each time. So 2 carb servings is 30 grams, 3 carb servings is 45 grams, and 4 carb servings is 60 grams. So like when you asked earlier, what's the recommendation? So for women, 2 to 3 carbs equals 30 to 45 grams per meal.
So 6 should be your minimum a day then?
I don't want you to think about it per day. I want you to think about it per meal.
Okay.
Because let's say I skipped breakfast,
Yeah,
you don't get to add those carbs onto another meal. You can't save them or bank them, because otherwise that's what causes those huge spikes in blood sugar. So think about it as, I'm gonna aim for 30 or 45 grams of carbs for this meal, okay? So if this was cereal, 1.5 cups of that cereal is 46 grams of carbs. That's your allotment for the meal. That doesn't include the milk, which is about 15 grams of carbs. So now that bumps you up to 4 carbs or 60 grams.
And fruit.
And fruit. So it's very easy for those carb amounts to add up quickly. And if you think about 1.5 cups of cereal in a bowl, it's not very much. I mean, my teenage son eats half a box of cereal in a sitting. So I stopped eating cereal because the portion is so small for so many carbs. Like, so that's, I wanna try to get the most bang for my buck. What's gonna make me full with the least amount of carbohydrates to keep my carb amount low? And then a snack. So snacks, again, remember we said we want it to be smaller. So a snack should only be 1 or 2 carb servings, which is about 15 to 30 grams of whatever the carb is you're eating. So this sheet here that I gave you, if you want to pull that out and look at that, everything on this sheet, front and back, tells you how much is 1 carb serving or 15 grams, okay? So for example, the front, it says 1 small apple. So for women, if you make a fist, a small apple should be like the size or a little bit smaller of your fist. If it's bigger than that, then you're gonna count it as 2 carbs or 30 grams, because some apples are huge, or if you cut it in half and only have half, okay? And then another good example I like to use is grapes. Grapes are high in sugar. So here it says about 17 small grapes or 15 large grapes. So about like a cup worth of grapes. Let's see, strawberries. Your berries are higher in fiber, so they tend to have less carbs. So like strawberries, 1.25 cups of whole strawberries is 1 carb or 15 grams. On the back side, so let's look under cereal. If you scroll down the column, it says pasta cooked. It says 1/3 of a cup of cooked pasta is 1 carb or 15 grams. I was gonna bring measuring cups today and I forgot to bring them. If you think of 1/3 of a cup, that's not very much. So 3 of those is 1 full cup. So I always tell people 1 level cup of cooked pasta or rice, but that's 3 carbs or 45 grams. So when I usually make a meat and a vegetable and a carb for my boys, but I will take a measuring cup and scoop out the rice or the pasta, level it off, put it on my plate. That's my 3 carbs or 45 grams. So that way you're mindful of, okay, this is what a cup of rice looks like, of cooked rice, or a cup of cooked pasta. So being mindful of your portion size to control the amount of carbs you're eating is important. So you could still have that thing. It's not like you have to eliminate these things, but how can I have less of it?
Is the portion the same for the whole grain pasta?
Yes, unfortunately. It just has more fiber in it, which is
Which
beneficial,
helps.
but the carb amount is about the same, okay? All right, so we said a cup of pasta or rice, you're counting that as 3 carbs or 45 grams. But if you go over to the column on the right under beans, it'll say 1/2 of a cup. So 1/2 of a cup of beans is 1 carb or 15 grams. So if you do a full cup, you double that. It's 2 carbs or 30 grams. So that's where I said like earlier, you get more bang for your buck with beans or lentils because they're less carbs, because they have more fiber and the protein. Go ahead.
Are those cooked beans?
Yes, cooked
Okay.
bean. Even if you do canned beans, like rinse them off, put them in a salad or something, same amount. But so you're getting protein, fiber, and still a portioned amount of carbohydrates with beans. The other thing I like to point out is if you look where it says other carbohydrates, sugar, honey. Think of a measuring tablespoon, not like the tablespoon that we eat with, a measuring tablespoon. 1 cup of sugar or honey is 15 grams of carbohydrates. So some people spoon in the sugar into their coffee or tea, and you're putting in probably, 60 grams of carbs just in your cup of coffee. And that doesn't even include the food that you're eating. So you see how quickly those carbohydrates add up that you're not even really paying attention to. And then juice. Juice is a big one. I do not recommend juice. I'd rather you eat the whole fruit, okay? Because typically 1/2 of a cup or 1/3 of a cup of juice is 1 carb or 15 grams. Where the whole piece of fruit, you're getting the fiber and the other nutrients from it, where the juice has been stripped of all of its nutritional benefits. So this is where I said, be mindful of what you're eating. What can I get that's going to give me the most nutrients and antioxidants and vitamins that I can get from what I'm putting in my body? So avoid the juice and eat the whole fruit instead. Okay? So this is where it's helpful to look at your label of packages of things that you're eating. It helps you to be more aware of how many carbs are in what I'm eating. Sometimes you'll be surprised. Oh, this didn't have as many carbs as I thought it did, or holy bejesus, this has a whole lot of carbs in it. So just moving forward, take a peek at everything and just so you're aware. Be more aware of what you're eating and how many carbs are in it. Okay? All right. Any questions about that part?
If you eat a lot of foods that are high in fiber, can you subtract that from the carbohydrates to an extent?
No,
Or
I
is it
don't like,
outside?
I don't recommend that because it makes it more complicated and confusing for people.
Okay,
If it has more fiber in it, it does slow down how quickly your blood sugar spikes. But you still have to think about the amount of
Portion.
carbs in the item, yeah. So yes, more fiber is beneficial. So you definitely wanna aim for those higher fiber things, but you can't like subtract. You know, you can't take away from the carbs because the carbs are still there. It just kinda slows that spike. Okay, all right, any other questions? The food is the biggest piece. It's like, how do I make those changes in my diet, regarding the food?
and as far as the Greek yogurt,
Uh-huh.
how is that, as far as the milk and yogurt part and the portions, how, is that the same?
Oh, yes,
Is
so,
that the
so
same?
milk, regular cow's milk, about 8 ounces or 1 cup is 15 grams of carbohydrates. If you do, like if you're lactose intolerant and you do like almond milk or coconut milk, as long as it's unsweetened, it has very minimal carbs in it. But like the vanilla flavor or sweetened tends to have a lot of sugar in it, so you have to be careful with that.
And what about the Greek yogurt?
Greek yogurt,
Plain Greek yogurt.
plain Greek yogurt is pretty low in carbs. It depends on the brand, but plain Greek yogurt is the best option. It might have like 5 grams of carbs in it depending on the brand. And I usually, like I said, I'll just add some berries to it to kind of sweeten it up a little bit. I don't mind like tart or sour things, but some people find Greek yogurt too sour. So you might need to add some berries or something to it to sweeten it up a little bit.
And you could actually use that as your protein for the meal too, right?
Correct,
Because
and
it
some-
has like 15, 18 grams
Yeah.
of protein.
And I use like an unflavored protein powder, and sometimes I'll just add a scoop of protein to the Greek yogurt and stir it up. So I get close to like 30 grams of protein for my breakfast, and then just add some berries to it. So that's an option too, if you use any protein powder of any sort to like supplement for breakfast. Be careful of like the prepared drinks, like the protein boosts and things like that. Those tend to have a lot of sweetener in it or artificial colors and flavorings and a lot of chemicals in it, yeah. If it's, my rule is if it has more than 5 ingredients and you don't know what the other 10 of those ingredients are, don't put it in your body.
I actually bought the protein powder and they had on TV, on national television, that there were metals or chemicals in it, so I took the protein powder back and got my money back. I was
Yeah.
afraid to use it.
Yeah, that's the other thing that's hard. Like, where is it being obtained from? How are they processing it? It's hard to navigate all of those things. But yeah, being aware. That's why I said earlier, you have to advocate for yourself and be aware of what you're doing, what you're eating, things like that. Okay, so the next thing we're gonna move on to is sleep and stress. Excuse me. So sleep is important. You need good quality sleep to improve your overall health. It helps to boost your immune system and your mood and your attention. Sleep also helps to clean your brain. So I know, hopefully you're familiar with like your lymph nodes in your body. That's called the lymphatic system. So there's something in the brain that they discovered, it's called the glymphatic system. It works very similar to like the lymphatic system, but this is specific to the brain. So getting good quality sleep helps to clean out your brain and make you more refreshed for the day. You wanna try to aim for 7 to 9 hours of sleep. It's good to establish a sleeping routine. Try to go to bed around the same time each night, plus or minus an hour. You know, it's hard to get to bed at this time every single day, but try to keep a routine every day, including on weekends, okay? And try to wake up around the same time most mornings. When you sleep in, it disrupts your circadian rhythm. So it kind of, you might feel refreshed, but then the next day you feel sluggish again. If you're able to get outside for a little bit early in the morning, that's helpful too. getting some daylight or sunlight helps to turn off the melanin in your brain, which helps us to sleep at nighttime. So when you see outside daylight, it signals to the brain, okay, it's time to be awake, turn that melanin off so I can feel refreshed and energized. And then at nighttime, try to dim the lights a little bit. Make it a little darker in your house. Don't have every light on, make it bright, because then the brain still thinks it's daylight and it's not allowing you to get ready to shut down and get ready for bed. So try to shut things down, dim the lights, so your brain can say, okay, it's time to start getting ready for bed, start developing that melatonin, I'm sorry, I kept saying melatonin, which helps you to get tired and ready to sleep, okay? Then stress. Stress, that's a hard one because life is stressful, things are going on, taking care of family, friends, people who are still working, but trying to find a way to de-stress. Stress can cause higher blood sugars and higher blood pressures. So even if you're doing all the things with your diet, if you have a lot of stress going on, that can still cause some higher blood pressure and blood sugar readings. So finding things that you enjoy doing to help relieve some of your stress. Getting outside into nature is great. You know, get out of your environment to get into nature. If you're at work or dealing with a family member, get outside for a few minutes. Community is important. Having friends, family, people that you can visit with, to help relieve some of your stress. People that you're, getting along with right now. All right, cuddling and hugging. They've actually done research on this to show that embracing, hugging, spending time with someone that you really care about releases those positive endorphins and helps to reduce stress. Just like pets. Does anyone here have a pet? No? Okay. So cats and dogs, they have found the same thing. Just petting a cat or dog has shown to release those positive endorphins to help relieve stress. So that's why pet therapy dogs and things like that are beneficial for some people. What were you going to say?
I was gonna say, for some of us though, I've worked for so long and I worked around people for 40 years, so I just want my freedom.
Yes.
I don't want.
I get that.
I kind of stay away from all the interaction.
Yes.
But that's okay too.
That's okay too, but we want to make sure that you're not doing that isolated, correct. You don't want to be isolated or feel lonely, because when people feel lonely, that can worsen mood, anxiety, depression as well.
I don't feel lonely.
Yes, yeah, definitely. Okay, all right, so the next thing is keep track. All right, so I gave you this little tracking sheet. You can use it, you don't have to use it. It's just a good example of one way to keep track. And what I mean by keeping track is if you're going to start a health journey or you want to improve your blood pressure, or your BG on this is blood glucose. If you're going to track these things, you got to write it down. I'm kind of old fashioned. I know there's a lot of apps and things like that where people can track these things, but then it's in my phone or on my computer, and if you don't have it in front of you, out of sight, out of mind. So if you have this piece of paper, put it in a spot that you're going to see every single day, whether it's at your kitchen table or whatever, so you can add to it every day and monitor your progress, okay? So it's 4 weeks worth, so it's a month's worth. So if you decide to use it, just make a copy of it. Use this as like your template. But put the dates. If you check your blood pressure, write it down. Check your weight. For women, it's good to measure your waist, like around your belly button and around your hips, because sometimes you might not notice the number on the scale is changing, but you'll notice that your clothes are fitting differently, and that's showing progress. And then I put breakfast, lunch, and dinner, so if you want to jot down, what am I eating? Am I noticing my blood sugar is getting better? For people who check their blood sugars. Does anyone here check their blood sugar at home? So if you decide that you want to check, because if you have pre-diabetes, insurance doesn't cover that. You can do an over-the-counter meter at Walmart. You don't need a prescription for it. You can get a meter, the little needles, the test strips, the little device to poke your fingers. That's what I use at home. I have pre-diabetes, so I track my blood sugar. And I just use the Walmart meter. And you can check it, once, twice, however many times a week that you want, just to kind of track how are my blood sugars doing. And how are the foods or exercise that I'm doing affecting my blood sugars? So that's one way to kind of keep track of your progress as well. And then the exercise column, I use that to keep track of my steps. So when you get yourself that pedometer, write down those steps so you can see, am I making progress? Am I staying the same? Where do I need to work on some improvements? Okay, so that's what this tracking sheet is it helps you to be more successful to see where do I need to make some improvements, okay? So here's just a little thing for anybody who's checking their blood sugar at home, or if you want to check your blood sugar at home. These are just some things of like little tips of when you could check. So remember, first thing in the morning, that's your fasting blood sugar, but you want to check it, empty your bladder, wash your hands, check your blood sugar. So that it's pretty quick, because the longer we're awake, our blood sugar continues to rise a little bit. So if you wake up and an hour or two later you check your blood sugar, even though you haven't had anything to eat, technically it's still a fasting, but it might be higher here than it was 2 hours ago. So you want to make sure you're kind of checking it right away, okay? Another time is before like lunch or dinner, okay? Or some people will check it after a meal to see how did the food that I just ate affect my blood sugars. So it says 2 hours after the first bite of your meal. Remember how I said earlier your blood sugar spikes the highest in the first hour, then it comes back down the second hour. That one's a little tricky because half the time I forget. So I'll start eating and I'll set a little timer on my phone for 2 hours to remind me to check my blood sugar. So that's why I say that one's a little tricky to keep track of. And then use these blood sugar readings as information. What is it telling me? Is it I had too many carbs at that meal, or my carb amount was good? So don't think of the numbers as good or bad. Just think of it as what is that number telling me? Okay? All right, any questions about that part? All right, so the main purpose of all of this was how can we reverse prediabetes and reduce insulin resistance, which then will help to prevent developing type 2 diabetes. So you want to work on improving your lifestyle habits. Those are the things that we talked about with getting more active, changing how you're eating, getting more sleep, and trying to reduce your stress. You want to try to reduce those processed, fried, fatty foods, reduce your carbohydrates. Again, just add more of the healthier things to your normal eating style, and then that kind of helps to phase out those not so healthy things. So don't feel like you're being deprived, add more good things, and then the other things will kind of start going away, okay? Adequate sleep, reducing stress, and then try to reduce alcohol, especially those sweetened alcoholic drinks, the ones that taste the best, those margaritas and daiquiris. And for women, as we go through perimenopause and menopause, our body actually metabolizes alcohol much slower, so we don't respond as well as we used to when we drank alcohol. So it disrupts your sleep. So that's the other thing with alcohol and why it's important to try to reduce alcohol, because it causes poor sleep quality. Okay? All right, any questions? I know that was a lot of information. We can go over it. But anything specific that you can think of anything that we covered or something that we didn't cover that you want to ask?
I have a general question. If you have almond butter or peanut butter, let's say you wanted to have that with a vegetable soup, how many times per week would you consider that? too often, or,
Oh,
and I try to get the ones that don't have, they're just the roasted almonds or the roasted peanuts, no salt or anything like that, nothing.
just the nuts or the butter?
The butter, but it's roasted almonds and
Okay.
it's just ground.
So that's where paying attention to the label is important, because one, does it have any added sugars in it? Is it straight up, nuts in the oil? Peanut butter is a tricky one because it's high in fat, so you still have to be mindful of the portion. So I wanna say for peanut butter, I believe 2 tablespoons is a serving. So, scoop it, scrape it off the lid so it's a level tablespoon. So just being mindful of the portions, how often you're having
Four
it.
times a week would still be okay.
Yeah,
2 or
that's
3
fine,
times, so.
yeah.
Okay.
It's just, and I don't, encourage like calorie counting. That's very complicated, and I want people to focus on getting quality food versus how many calories am I having. Because if you think about, this donut is 500 calories, but this salad with a chicken breast in it and other things in it might be 500 calories. That's a big difference, So if I'm counting calories but eating this versus this, you're still not getting the nutritional benefits. Plus, when you reduce the amount of carbs you're eating, it naturally helps to decrease the amount of calories that you're eating. So again, focusing on those nutrient-packed foods versus foods that don't have very many nutrients in it.
I try to follow the Mediterranean, but that,
Mhm.
you have a lot of questions at times about it, I still have to look and see what,
Yeah.
I like to try to.
Yeah, and again, just focusing on those proteins, vegetables, reducing the carbs, healthy fats like your olive oils, avocado oils, things like that. Every little bit counts, and it sounds like you're being mindful, so that's what's important. Okay, anything else?
I saw that you had beans
Yes.
as part of carbohydrates, but I thought that was a protein.
So the main source is actually carbohydrates, but it does have protein and fiber in it as well. So I'll cover that with you in a little bit. I'll finish with these ladies and then we can go over that. Okay, any other questions before we finish up?
I read one book one time and this one person says, it's like a bank, my carbohydrates, I have to be careful with my deposits and withdrawals, so you really wanna think about what you're eating. You said
Correct,
mindful.
yes. And like I said earlier, you want to divvy up the carbs throughout the day. You don't want to not have any here and then pile them all up here, because if you're trying to pay attention to your blood sugars, all of this here is going to shoot your blood sugars really high. You need that like slow, steady fuel, basically think of it as, to keep you going throughout the day. So, yeah. Being mindful of what you're putting into all of those little buckets.
My phone has the pedometer on it.
So the tricky part with that is that, do you always have your phone on you?
Almost always.
Okay, so
Because I can count my steps.
correct, yeah. So like for me, my watch counts steps, but I'm standing here and talking with my hands. It's counted a whole bunch of steps, but my phone is over there. So this is usually says I have more steps than I've actually taken. So that's why the little pedometer is so helpful, because you can just clip it on your pants, just go, and if you forget your phone, you're still getting credit for your steps. But if you have your phone in your pocket or you carry a purse with you all the time, then yes, definitely use your phone. But a lot of time I don't have my phone on me, so it's like I'm not getting credit for all the steps that I take if I don't have my phone with me. So that's, you just kind of have to see, how can I gauge where I'm getting, how many steps am I actually getting each day. So the little low-cost pedometer is great, so that's another option. All right, anything else?
It's very helpful information.
Good,
Thank you
good.
very much.
Good. All right, well then, thank you so much for coming, and I wish you all great success on this health journey.